Dr. Vitalis Ogola. I'm a dentist at Royal Dental Clinic in Kisumu, Homa Bay, and Migori. Today we have partnered with Ponea Health to create awareness on various dental issues, and the one for today is about bad breath. Generally, bad breath is a very common problem that I would talk about. There are two levels of bad breath from a professional angle. There are people who genuinely have a bad breath. There are people who perceive that they have a bad breath. There are people who think that they have a bad breath. Normally, people who think that they have a bad breath are people who probably have been told by their spouses, their colleagues, their friends. There are people who have a bad breath, but they don't recognize that they have a bad breath. It is fair that if you see anybody that has a bad breath, it is always a good habit. Don't close your mouth or run away from them. Find a friendly way to inform them that you have a problem, but don't mock or chide people who have a bad breath. So two categories, the people who genuinely have a bad breath. How do we define this largely for population is, as I said earlier, it is normal for you to have a bad breath when your mouth is closed for a long time. When you talk during the day, your tongue is active, you have saliva being produced. So during the day, people don't tend to have a bad breath. But when you're sleeping at night, there's bacteria in your mouth, there's food in your mouth that makes your mouth have a bad breath because bacteria is breaking down the food, which leads to the bad smell. There's a byproduct that comes off it. So when you wake up in the morning, because your tongue was just quiet, it means there's a lot of the foul smelling products of the bacteria which lead to that. So if you wake up in the morning, brush your teeth, and after brushing, you still feel like you have a bad smell, generally, then you need attention. But if you've brushed your teeth and you feel like your mouth smells fresh, then you don't need attention. So from there on, now you need to see a dentist to have your teeth cleaned. But as a good habit, be in the habit of having your teeth cleaned routinely so that you don't have a bad smell. If you feel that your gums are bleeding when you're brushing, you see you spit a lot of blood, then you also need to seek to have your teeth taken care of. Don't just ignore the bad breath as something that will pass away, because there's the risk of you losing your teeth prematurely. Now people live longer, people live into their 70s. So if you lose your teeth too early, that would not be in your interest. Thank you for taking your time to listen in to the information that we've shared. We are grateful and hope that you've learned something from us. Should you seek to get our services, we at Royal Dental Clinic in Kisumu, Homa Bay, and Migori, feel free to reach to us through ponea.com, which is a platform that enables you get to us. And beyond this, there are many topics that will come your way in dentistry and others through Ponea in other episodes.